And I'm sure that we are going to have a very interesting session. One of the most interesting things that I found here is the name of the nutrition and dietetics. The topic itself is very interesting. This shows how and where we are moving in the field of nutrition and dietetics, past, present, and future. This is one of the sciences, probably, especially in our country, where the future is with the past. Dr. Hema Devakar has just very rightly mentioned about the importance of millets and diets. And this year is being celebrated as Year of Millets, and which would have a profound impact on many of the issues which were discussed by Dr. Hema Devakar about anemia and obesity. So these are some very important facts that we are going to discuss. I know that we are getting late. We are already late behind schedule. So I won't be standing between you and the discussion. I would request Dr. Anup sir to start the discussion. Sir.
Thank you. Let me thank Rajput sir for giving us this opportunity, and thanks Kesri sir for context setting. As you can see that we are continuing from the previous session. I'm the only man, rest are all power pack women here. And I'm sure by the end of session you will know how power packed they are, because each one of them carries a wealth of not only the knowledge, the extreme experience. For example, I've been associated very closely with Mrs. Rekha Sharma from All India Institute of Medical Sciences, and the top endocrinologist in this whole country, Dr. Bajaj and Dr. MMS Ahuja, we used to take around together. She used to sort of manage all the VIPs from presidents to prime ministers at that time coming to All India Institute of Medical Sciences to the common man. She has, I would say, perhaps the largest experience as far as nutrition is concerned in this country. Of course, my illustrious colleagues, Shikha is my very good friend and a name by herself, and so is Ishi. Both are working in separate areas of nutrition. But what I'm going to do is touch upon some of the burning nutrition problems facing not only the country, but also the social media. Because this is the age of social media, and the most of the conceptions or misconceptions arise from the various tweets or WhatsApp messages or on Facebook. So they start from that, and it perpetuates like anything. And every patient who comes to me for treatment of obesity, diabetes, and related disorders, first thing or one thing that they ask is a nutrition-related misconception. And I actually spend a lot of time in clearing their misconceptions. So some of these misconceptions will be discussed here, and I will fire the first salvo to Mrs. Rekha Sharma, and that is the burning topic today, that of fad diets. Fad diets and intermittent fasting. So, Mrs. Rekha Sharma, what is your views of the intermittent fasting as of today based on the evidence?
Nice to be here today, and a nice interaction. Just to brief the people as what is intermittent fasting, it is when you fast few hours and then eat. It could be 8 hours, 12 hours, 16 hours. Some people do it on alternate days as well. So it has advantages and disadvantages, to brief it. Advantage is that when you're fasting, your body is taking the reserves for energy and you lose weight. But when you're fasting, your BMR goes down, that is basal metabolic rate goes down when you're starving. So the body sedates itself, so you are not likely to lose weight unless you restrict the total calories. You also get some bloating when you do fasting, because people get hyperacidity and they are not used to the system. And the biggest disadvantage is compliance. You can do intermittent fasting for a few days, you can do for 4 weeks, you can do 6 weeks, you can lose a little bit of weight, But eventually, if there is no compliance and you come back to square one to your family meal, it has no advantage. Now the scientific data has also shown that whether it is intermittent fasting or whether it is your normal routine where you reduce calories, if the calories remain the same, there is no advantage of intermittent fasting at all. Another thing that we really need to be careful is that how much exercise you do. You can do fasting, you can do any amount of diet, you can take low calorie diets, you can do intermittent fasting, but unless you do physical activity and keep active during the day, we are not going to have any weight loss, because as I said, that activity will keep your BMRs high, your basal metabolic rate high, and will you keep going. So whether you do intermittent fasting or whether you do regular calorie restriction, eventually the result is the same. However, people, it is fashionable to say that I am on intermittent fasting. So this is the burning issue, like Dr. Mishra has just said.
Thank you, Mr. Sharma. So let me just rephrase this and summarize this in some other words. Intermittent fasting is the current fad. Why is it a current fad? Because it is easy to do. It's very easy to do. One of the patients came to me and said, well, doc, you say you don't eat this or you decrease this or that. What I do is 8 hours to 10 hours I don't eat, and then I eat whatever I want. So that gives them a freedom to eat, which is also not good. So it's easy to do. It is something which is being perpetrated through the social media that is very good. But scientifically, all studies have been compared between the usual conventional, the weight loss diet that we do, you decrease this, decrease that, have a proper diet chart of 1200 calories or 1400 calories per day versus intermittent fasting. The diets, the studies which have been done, intermittent fasting, no change in the results. And in this respect, I must tell you about a study which came just 2 days back, and that concerns one of the prime organ for metabolism. And Dr. Gaur Chaudhary right here is one of the best experts in country as far as liver, fatty liver is concerned, which is the current epidemic along with diabetes. What happens to the fatty liver as far as the intermittent fasting is concerned? This is what Chinese researchers, they researched up to 12 months, and one group received intermittent fasting advice, the other group received the usual, the calorie restricted diet. They employed one of the best investigation to assess the liver fat, and after 6 months and after 12 months, there was no change at all between the two diets. Again, reiterating that we are no better with intermittent fasting. And maybe we are going to be worse, and certainly what Mr. Sharma has already said, that it is not sustainable on a long-term basis. At this time, I will request all of you to write down your questions and your name and send it across to me, because we would like to entertain the questions while we ask the panelists the questions at the same time. My second question is to Dr. Shikha Sharma. Shikha, we talk about carbohydrate, we talk about fat, this fat is good, that fat is good, bad, and things like that. We hardly ever talk about protein. So what are your views about why should we talk more about protein, and why we Indians should have a good amount of protein?
Excellent question, and let me say one thing, that whatever views I present today are my own views, and I'm known for being a little disruptive and very, very curious. So before I answer your question, let me go back and see this logo which you see, this sign which all doctors use. This actually is an incorrect sign. This is the rod of Caduceus, which is a sign for commerce. It is not the sign for healthcare. The sign for healthcare is the rod of Asclepius. Asclepius was the son of Apollo and the father of Panacea and Hygeia. So hygiene and Panacea, which is remedies, formed the healthcare system from ancient Greece. So like this, being very curious, I try to understand why. Why and why. So coming back to your question about why don't we talk about proteins is because protein is a very misunderstood thing today. When we talk about protein, we see bulging biceps. When we talk about protein, we look at malnourished children, that they're not getting enough protein. When we talk about protein, we talk about different kinds of protein, whether it is whey protein, which incidentally the entire dairy industry is throwing away. We talk about soya protein, and then there is confusion, is soya good or is soya harmful? Or should soya be taken as tofu? Or is paneer good or is paneer bad? So fundamentally, what is critical is how, okay, so one of the questions which I asked myself is, how do animals get protein? Let's look at an elephant. Let's look at a lot of other animals. How do they get their protein? So I think today I don't have a real answer about how does protein work, but one thing I'm very sure, the problem of protein absorption starts from our intestine. We are not able to absorb enough protein, number one. And my friend Ishi would be talking more about it. The second thing which is also a problem is, what are we combining that protein with? Because a lot of times when we do wrong combinations, which is written about in Vedic nutrition, there is a problem. Like as doctors, we were talking about that, okay, don't have calcium and iron together, don't have this and this medicine together, because they might not have a good combination. But when we talk about food, which is also a biochemical actually, really, I mean, if you look at structure of a protein or an amino acid, we are all made of carbon, hydrogen, oxygen. 62% we are water, H2O, 2 atoms of hydrogen and 1. So the simple answer would be that how we absorb protein depends a lot on what is the state of our intestine. If our intestine is inflamed, we will not absorb protein. If our liver is unhealthy, we will not assimilate protein. If our food combination is not right, we will not digest protein. So what I'm trying to say is that you get protein from a lot of sources, like peanuts, like sesame seeds, like plants. The problem is we don't understand protein enough, and that is why lack of information and awareness creates a lot of deficiency. Sorry, a long answer to a very...
No, thank you. No. That's absolutely fine answer, and we fully understand what you are trying to say. What I understand, but I'm sure others also have understood well. The one thing which I want to fill in with this answer is that Indians have, in general, lower protein in the diet. And so around, if you say percentage-wise, out of 100%, how much is the protein? 12% for Indians. And how much is it for Western world? For white people, 20%. Of course, they eat non-veg in the afternoon and in the evening, and wherever. We are non-veg, we eat less of non-veg, and many of us are vegetarian. What is the consequence of that? The consequence is our weak muscles. Muscles are particularly weak, and muscles are powerhouse as far as glucose metabolism is concerned. And hence our glucose metabolism goes for a 6. So while we say we are fat or everybody is getting fat and that's why diabetes is increasing, that is a partly true. And our muscles are weak, that's why also diabetes is increasing. And eating more protein will actually make you up, along with the exercise, make your muscles up, and maybe if you are predisposed to develop diabetes, then you will have less of diabetes. At this time, a very burning question facing this country, and that is that we are seeing two Indias. One is the undernourished India, the other is overnourished India. And so this is my question to Ishu Khosla, that how can we tackle both burden of undernutrition and overnutrition in this country? What could be the strategies?
Yes, thank you, Dr. Mishra, for a very, very complex question, and something which is really facing us in a very glaring way, both whether it is undernutrition or overnutrition, it's all about malnutrition. And I think what the first comment that I would like to make here is that our current strategies of treating both micronutrient or macronutrient malnutrition, or we call it overnutrition or lifestyle-related diseases or metabolic diseases, etc. The strategies that we are using are not working for us. And it's not only for India, it's global. According to some projections, by the year 2035, half our planet will be obese. A quarter of us in India, cutting across age groups, cutting across socioeconomic status, we are suffering obesity like never before. Which means whether it's physical activity or it's calories burnt or calories intake, the equation is not adding up. And I can tell you that from my clinical experience. I have patients who are eating as frugally as 800 to 1,000 calories, working out 2 hours in the gym, highly motivated, and yet not losing weight and sometimes even gaining weight. How does this happen? And that's when I think we need to understand that whether it's an individual approach or the approach for a public health perspective, we have to learn to join the dots. Maybe our policies, maybe the strategies need to be revisited and reviewed. And while I'm a nutritionist, I'm a practicing nutritionist, I have studied nutrition, the ABC of nutrition, I'd like to say that it has really helped us understand food much better. But when we pass it on to our people, we are making mistakes. Somebody is counting calories, somebody is counting fat, somebody is counting proteins, and it will all be so lopsided. And we are getting burdened with what we call fad diets. It's really, I see it all the time. And that, there are, to answer your question one line will be tough, but all I'll say is we need to revisit and rewind our perspective about food and nutrition. Nutrition is a young science, a very valuable science, but let's now focus on food and in a whole different perspective. Let's talk and communicate to people the right way. The landscape has to change. The food landscape has to change. The ecosystem around us, the food, the agricultural practices, the food industry has to evolve to make healthier food. We have to go back to food practices, food eating practices, what to eat, when to eat, how to eat. All that is important.
Rishi, what we got is that we need to do a lot more as far as food is concerned.
And customized diets.
Yeah. So we have a limited time, so we'll have to limit our answers in a way that others can ask questions. There is a question for you subsequently. So at this point of time, I would say we have been talking about food for a while now. And it is something which is a personal choice, very difficult to actually change these habits. And the government of India is doing something about it. FSSAI is also doing something about it. But this is something which is a huge challenge. And to tackle both undernutrition and overnutrition at the same time, most of the governments are failing, and as yet, our system is also failing. At this time, I will, it's a very interesting question from Kavya. Kavya, please stand up. She is a student from Manav Rachana University. You have asked a very interesting question. Do you think that today's diet we should concern about the maintaining right omega-6 and omega-3 ratio balance? As some studies show that in today's diet ratio to omega-6, omega-3 is 19:1, whereas old time was somebody doing omega-3 in the blood? No, I don't think so. Let me tell you something on this. Omega-3, first of all, for everybody, omega-3 comes from the long chain fatty acid. It's a fat, and mostly coming from the fish. That's the only source of omega-3. Omega-6, there are multiple sources, including some of the nuts and so on. In Indians, omega-3, because we don't eat fish, most of us don't, is less. And that has been shown in several studies in the UK that our blood omega-3 fatty acids are lower than the Western population, which is understandable. And if you go to the coastal areas of India, omega-3 is more, because there they eat fish. Now, whether omega-3 should be taken more, there is some supporting evidence, because it is possibly good for triglyceride, one of the components of fat. It is possibly good for heart also, and possibly good for blood circulation. But nobody has proven for, totally in no uncertain term that it is something which is absolutely essential to take omega-3 in the right ratio. Because all these things are theoretical, the ratios are all theoretical. And nobody in the previous this thing has ever done any ratio, and whether long-term studies will show that these ratios are actually useful or not, that is something not proven. But omega-3 is something which can be taken, and there are other sources of omega-3 which are vegetarian sources, like flaxseed, etc., which can give vegetarians a little bit of omega-3. So those of you who are not taking flaxseed, please start taking that. That's one good source of omega-3. Let me come back to Mrs. Rekha Sharma. Now, there's so much of talk about millets. Are we going to change our diet to millet diet and be very carefree that we'll be better off tomorrow, or there are pluses and minuses of millets, and actually starting from what is millets?
Actually, now millets is nothing new to this country. It is a traditional food. We have a gut for millet and we have a palate for millet. And the jowar, bajra and ragi are the prominent ones that we normally use. The government of India has also done this. This is the millet year of the millets. Even internationally, this is the year of the millets. We are trying to promote millets for two reasons. One is that the crop requires very little hydration or very little water, so it's easy to grow for the farmers. And second is that it has lot of micronutrients, it has fiber, and it has low glycemic index. So therefore, since we are heading out to be the diabetic capital of the world, so the feeling is that if the rice and your wheat can be exchanged by millets, which was our traditional food, the glycemic index being low, the blood glucose response will be less, so there will be less of blood sugar rise. Secondly, it is very rich in iron and calcium. It might resolve issues of iron deficiency, and calcium is required for all age groups, starting from the baby to the elderly. It's a good source. It is a power-packed grain. So it is good to use. There are a lot of recipes that are going on. Even if you go onto the net, every day there is one recipe given. It is little hard to cook because it's a harder grain. So it's good to soak them and have them. You can take it for breakfast in the form of gruels, or you can have a chapati or something. But it's a good thing to have. A lot of studies have shown that it's good for your heart. It brings down the lipid profile. It's good for your diabetes. For patients who are already diabetic, it brings the blood sugars down. It is good for the gut. It is good for Crohn's and other diseases, and good for constipation. And it is basically heart healthy, a good product to use. And I don't think the switching should be a problem for us, because it is a traditional food. We already have gut and the palate for it, so I think we should go ahead with it.
Thank you, Ms. Sharma. Number one, millets is nothing new, and our traditional diets have millet, but good to have it back. Number two, if you think that you can change your diet just by millet and change your metabolic status just by changing millet, you're wrong. Because you have to change the whole diet in a way that millets are combining with the other nutrients to make you better, and that you are exercising enough. So you cannot say that I have incorporated millet, but I am taking saturated fat, and I am taking a lot of portion size is this much, and that I'm not going to exercise and millets will make me healthy. That's not going to happen. That's one thing sure.
Yeah, one thing more. Calorie-wise, they are not lower than what we call your wheat or rice. Calorie-wise, they're practically the same grain, but they're very high in fiber. So incorporate them to healthy eating practices. Lots of fruits and vegetables, good quality oil, healthy oil, good proteins, low fat, healthy oils to be, low saturated fats to be used. So basically, a healthy fat, and lot of fruits and vegetables and a good grain will eventually help.
Thank you. So I come back to Shri Khosla again. There's going to be mango season at this point of time, and there's a lot of issues regarding mangoes. So what are your views? Number one, in two ways you can answer. One, for normal people who are non-diabetic, and number two, who are diabetic.
Well, I was just curious to know how you picked on mango, but yes, mango seems to be your favorite fruit. But yeah, and this is a question which is so often asked, irrespective of diabetes or non-diabetes status. And all I'd like to say is mangoes are wonderful fruit, wonderful food, and they have a place in both anybody's diet, whether diabetic or no. And it's all about how much you take. That's the portion control. And even for diabetics, there is absolute place for, for mangoes. But again, oversimplification of facts. Matlab, how much of other carbohydrates are you taking? I can replace my rice or roti with a mango. Sure, I can do that. And mango actually is good for the gut. And today the whole conversation, the narrative has changed to talking about the gut as the organ to address, to fight all diseases. So, well, it is gut friendly, and it has a fairly modest glycemic index, and it has fiber and micronutrients and antioxidants. So go for it. Just watch your portions.
Thank you, Ishi. That's an absolutely wonderful answer. What we are doing at this point of time is doing short and long-term studies with mango under Indian Council of Medical Research grant. And we are going to see whether mango produce, with different varieties of mango, not one mango, with different varieties of mango, produce blood glucose response in response to the ingestion of mango versus the glucose. And the number two is continuous glucose monitoring over a couple of days to see mango ingestion actually increases the blood sugar over a period of time, and then 3-month study of mango juice. We have just completed our studies. We are compiling the data. But initial data look very, very interesting, and we'll be probably able to open those in the in next 6 months.
There's something to add here, Dr. Mishra, that also the ripeness of the mango changes.
Absolutely.
Raw versus
Can I add one tip? Just a tip for fruit eating. Anytime when you take a fruit away from the meal, if you take 8 or 10 peanuts with it, it brings down the glycemic index. So it's good to have fruit. If you have some peanuts, the sugars do not rise very much.
Okay. Now, there are a couple of questions here from the audience, and I think because we have limited time, I want to accommodate as many questions. So I'll keep on answering in between whatever I can and take help of our expert. One thing is that as far as diet for liver is concerned, diet for liver is just the balanced diet. One thing I want to emphasize here is that, of course, Dr. Gaur Chaudhary knows better, but Dr. Bhargav has also come, is that there is a very, very good study from Sweden which shows that if we are using the two types of fat and one sugar in the diet, three group of people, and saturated fat diet, which means there's a lot of palm oil, ghee, coconut oil, all these are saturated fat. The second one is high sugar diet, and the third one is monounsaturated fatty acid, MUFA, which is good for health. These three diets, if we use, it is the saturated fat diet which does the highest damage to the liver. Number two is the sugar diet, and monounsaturated fat actually improves the liver health. So there are going to be different response of liver fat to different nutrients, and I'm sure Srinivas, who has asked the question about fructose, can interact with Mrs. Sharma later on. Now there is another thing which is a little bit of sort of a debatable question is what Dhananjay has asked. Dhananjay is right here. I know what he's going to ask this question. Dhananjay.
There are 3 empty witters and 1 witter. I want this to be resolved today.
No, it cannot be resolved. That's one thing sure. That's my answer to it. But and I'm sure off the dais you can talk to people. All I can say, those the rotis have, wheat has its own benefit. All I can say, the wheat has its fiber, wheat has a protein, and it's not just carbohydrate. So if you compare wheat with the rice, certainly wheat wins, and wheat actually gives a huge amount of fiber and protein to us who are short on fiber and protein. So for some reason you may change if you are sort of not tolerant, but other reasons you should continue. I'll come to you, Ishi.
May I just add a little bit to what you said? I mean, I totally agree with what you said, that wheat is a wonderful grain, and it has stood us from 10,000 years it's been used. But somewhere I think there are problems with certain people who have wheat, and they are pretty well known now, and maybe like milk and some other foods where we have lost oral tolerance due to other environmental reasons, and that's probably where we are.
Thank you. So Dhananjay will have the continuing debate after the session also.
अमृत काल में डाइटिशियन से बात करो तो लगेगा कि ये जो बीट है एक पॉइजन है।
नहीं नहीं, ऐसा सब लोग नहीं करते।
इसको दूर करिए।
नहीं, मैंने तो देखिए, आपने जब पूछा तो मैंने स्टेटमेंट भी दे दिया, और
आधा हिंदुस्तान तो खाता है वीट को।
और दूसरा आपने तो आर्टिकल में मेरा स्टेटमेंट भी छाप दिया है सेम स्टेटमेंट, तो वो तो मैंने उसी से मैं आपका रिजॉल्व कर दिया था।
Well, yeah.
We'll come to Shikha. Shikha, the keto diets have been, sort of encouraged for weight loss. What are your views about keto diet?
So fundamentally, if you look at keto diet, it started not for weight loss. It started as a clinical therapy for kids who are having seizures. Unfortunately, as what happens is that a lot of times a particular diet, because it's very easy to understand and you don't have to make many changes in your diet or lifestyle, becomes a fad. And keto diet became a fad because a lot of athletes who wanted to use it for endurance sports like marathons started using keto because the medium chain triglycerides which keto gave them endurance. Then it was passed on to the people who wanted to lose weight, because in weight loss what fundamentally happens is that whatever you're eating, if it has a lot of high sugar forming products, which could be bread, which could be noodles, which could be whatever, you tend to put on weight if you have a certain body type. In keto diet, because they were having only oils, medium chain triglycerides, they were losing weight and very quickly. So it became very popular. Now, as a doctor, what do I see? The first thing I see a keto diet is, where are the vitamins, the minerals, where are the vegetables, where are the fruits, where are the fibers? So how can a keto diet be balanced? Now, a lot of people would say, okay, I lost weight, and that's fine. It's not fine, because the raw material with which your eyes are made, your liver is made, your muscles are made, is missing in keto diet. That means you're heading for severe problems which will go undiagnosed, because it could come up as an allergy, it could come up as a liver problem, it could come up as an inflammation. The biggest problem in today is, and if I may add, is the oils we are eating have been refined using so many chemicals that they themselves are a major cause of inflammation in the body. The oils which are being refined have acid, they have alkali, they have bleaching agents. It's poison which is going inside the body. So that's the inflammation which is causing a host of other problems which are going undiagnosed.
So are you for keto diet or are you against keto diet?
I'm completely against keto and all diets.
Well, that's
all diets.
See, Dhananjay, see this statement? It's been resolved.
No, they are not speaking in front of you.
Okay.
There is an elephant there, I can see. No one will talk about that.
Okay.
I don't press it.
Okay. Keto diets. So let me summarize what Shikha has said in a very, very detailed manner. Keto diets are for a short term, they may be good for those people who don't have any problems. They are not diabetic, they don't have a liver problem, they don't have kidney problem, they don't have cardiac problem, and they are obese, and just for 2 or 3 months maybe weight loss. But even these people, now recent study, why I put this topic right here? Because all these topics have been backed up by recent very good data. Recent study just a couple of days back showed that those who undertook keto diet, over 2 years' time, their heart attack rate went up and their stroke rate went up. So be careful, because these diets have lots of imbalanced nutrition, and also I will come to, I'll ask Ishi that particular question later on, but let me just begin that some of these keto diets have some artificial sweeteners, and one of them is called erythritol, which has been proven to increase stroke and heart attack risk. I come back to Mr. Rekha Sharma, and one of the questions which will be asked by one of the, who has asked this question?
Being a vegetarian, how do I improve? Being a vegetarian, how do I improve my gut health?
So, who has asked this question? Nobody.
Well, being a vegetarian, you already have a better gut than anybody else. Take lots of fruits and vegetables, take a lot of whole grains, and take small frequent meals. Do not starve yourself. If your diet is getting low in fiber, you can take some muesli or something, you can add on to it. And vegetarian diets are practically much more healthier because they are more rich in fiber, and therefore it's better for the gut.
If you need to further improve the gut health, then you take the lactobacillus preparation, which is simple as dahi. So increase your curds intake more, and there's a good high amount of these good bacteria found in some of the commercial dahi preparation which are available now. So you can use that and improve your gut health. I come back to Ishi Khosla, and this is a very, very important question. Now all of you should listen to this answer, because in our lives, all of us, whenever you go to such 5-star hotels or something like that, the table, if you have tea, then the next to it will be one sugar bowl and other artificial sweetener bowl. And you will take artificial sweetener if you are trying to lose weight, and you will not look at the label mostly. You will just tear off that and pour in your tea coffee. Some people will take brown sugar out of those pouches, and some people will take white sugar. So here I come back to Ishi and ask whether this is a healthy practice, taking artificial sweetener.
Thank you for a very important question, Dr. Mishra. I do see that all the time, and we are plagued with fake food thanks to many, many complex reasons. Simple answer to your question is that I heard the word gut health, and thank God for that. We did speak about it. But if we were to really understand where we are going wrong today with public health nutrition, with the so-called day-to-day disorders, diseases, everything starts in the gut. And that's not what science is saying, has said earlier. It was 2,500 years ago, Hippocrates, the father of modern medicine, had said all diseases begin in the gut. Ayurveda said it, and many other forms of traditional medicine have endorsed that. And today, modern medicine is saying the same thing. So we are on the same page. And like Dr. Mishra just said, we're talking about lactobacillus, but there are trillions and trillions of varieties and numbers of these bacilli, fungus, and these various microorganisms in the gut which determine our health, who we are, mentally, physically, and externally. Our hair, skin, eyes, our internal organs, our health, mental well-being, everything is being controlled by the balance of these good and bad microflora. It's real, and they're real time. And they're all over your body, but the maximum is in the gut. So what goes into your gut, if it is friendly for these bacilli or the fungus or the viruses, if they are friendly for them, they work for you. If they are toxic for them, they go against you. Your gut really is the control panel. As a matter of fact, my latest book, The 4G Code to Good Health, Gut, Girth, Gluten and Glucose, is just released a few months ago. And that's exactly what we have talked about. So anything toxic, anything artificial, be it a sweetener, be it pesticides, be it chemicals, additives, flavor enhancers, etc., or medical medicines, they all disturb the balance between the good and the bad bacteria. So here is obviously the answer to your question. And in my clinical practice, I had a patient many years ago, 20 years ago when I was in escorts, and said that whenever I have a Diet Coke, my sugar goes up. And whenever I have a regular Coke, it's all right. And I said, no, it's not possible. You must be eating something different, something, I didn't believe it. And today, scientific data supports all of these observations that these sweeteners can actually increase the risk to diabetes and obesity. It's better to take small amounts of sugar, unprocessed sugar, whatever sweetener you want in modest quantities, than to disturb the gut flora with chemicals. And yet, let me also say that not all the sweeteners are the same. We have today stevia, which is a relatively speaking, a safer sweetener because it is of natural origin.
Thank you, Ishit. That's a wonderful answer. Let me fill you up on this again because the importance of the topic is so much. It's something that we do every day. The sweeteners started with saccharin, and when the saccharin it came, there was some evidence from the rats studies that it increases the risk of the tumors, but subsequently not proven. And then aspartame came, and sucralose came, and then erythritol came, acesulfame came, and stevia. So there are 6 artificial sweeteners which are generally, it is a very, very bad term and a very broad term used by FDA, Food and Drug Administration, USA, generally recognized as safe. Generally recognized as safe means it may be unsafe also. Based on inadequate number of studies. The studies were not much. It is only in 2022 that we became wiser, because 2 large-scale 100,000 patients studies from the French people said 2 things. Number 1, that as far as the sweeteners are concerned, they increase risk of diabetes because ultimately brain doesn't recognize artificial sweeteners as sweet, and you ultimately tend to crave more and eat more. And the second thing is they increase risk of certain cancers and heart. Now that was the French researchers in 2022. 2 large-scale studies, widely debated, and totally demolished by the beverages company because they don't like it. Because aspartame is there in your cola light or whatever cola that you are eating, which is say 0 calories, or whatever else you are eating which is 0 calories, and that mithais that you may be eating during Diwali which says diabetes friendly food and so on. Everything has artificial sweeteners. But what is more damaging is a recent study just 1 month back where erythritol, that I can come back to Ishi's answer that stevia is safe, that it is at this point of time. But beware, stevia powder, many products have a stevia powder which contains erythritol. And hence, you should be careful. Why? Erythritol, once ingested, remains in body for 6 days. It doesn't go up and causes the blood coagulation to increase in so much increase that it can cause heart attack or stroke. So you take 1 and 6 days you are at risk. And it is mixed with most of the sweeteners because it is the taste of erythritol is like sugar. It does not leave aftertaste like any other. And that it is not as sweet as other sweeteners. It is all 60 to 70% sweetener as sugar. Very good. You mix it, no aftertaste, sugar sweetness comes down, it looks like sugar. So those of you who follow me on Twitter or on Indian Express, every 15 days I write on something on the nutrition or related topic. Please look back in the web. 15 days back I wrote same thing on artificial sweetness, and please follow that. We have one more question, and after that we will summarize and we'll close. And that question is, intake of high protein is causing the risk of heart attack in general. Shruti.
Shruti, your question is interesting. Depends upon high protein source. When you talk of high protein, it will create confusion for heart attack if it accompanies saturated fats with it. So if you take proteins from red meats, or if you take proteins from whole milk, or if you take proteins from whole dahi, it will be accompanied by saturated fat. So proteins are very essential. Most of us are deficient in this country in proteins. And as Dr. Mishra has mentioned earlier, that most of these proteins is also the low protein diet amongst our populations is also the cause of having more diabetes in this country, because we have low muscle mass. So you need proteins, but choose your proteins from sources which do not accompany fat. So low fat milk is fine. Your dals are very good. Your soya bean is very good. It has no saturated fat in it, and your pulses, your besan is etc. is good. So choose wisely and go for low fat sources. If you want non-vegetarian, take chicken, skip the egg yellow part, take the egg white, but avoid mutton and ham and sausages for source protein. So there will not be any risk of saturated fat. So it will not give your hyperlipidemia, or it will not increase lipids in your blood. So then they'll be very safe. Proteins are absolutely essential, but just take the low fat ones.
Last one line advice to everybody. I'm very happy to see young people sitting here from various universities and so on.
My thing would be that we are talking in pieces. By and large, there is no individual diet for any disease. Like you can't say that, okay, for heart attack I will be having this, for my diabetes I'll have this, for weight loss I'll have this. Well, there's one general healthy eating diet, and it should come from within your family meal, from your own dining table for compliance. So try to modify your diet, which is already there, your cultural pattern, your eating pattern. Do not go for fancy fad diets that are for a particular individual. Enjoy your family meal, make your family meal healthy, use whole grains, take lots of fruits and vegetables, take whole dals, use low fat milk, low fat dahi, and good quality healthy oil.
Thank you for that, ma'am. Perfectly said. I'll just add on the fact that the road to good health is paved with good intestines. And please work towards building up a good gut flora. And today, this year, 2023, the Honorable Prime Minister has declared the Year of the Millets. The first time a Prime Minister has declared something to do with a positive message towards food. And I think that's really heartening. Let's take it seriously, because I believe that the grain change can be the game change.
I would say two simple mantras. First is hydration. You have to drink enough water. Your body is 2/3 water. Second thing I would say is anything, and just about anything which has processing, whether it's oil or products, remove it if you want to live a long life and a healthy life. Processed foods are killing our society. Just get rid of them. Unless you are stuck somewhere, don't eat them.
Can I add
Thank
one
you.
more thing? Can I add one more? We cannot close this session without talking of exercise. No amount of healthy eating will help you in weight loss or maintaining good parameters unless you exercise every day and remain active during the day. So nutrition and exercise go hand in hand. Let's combine them both.
Thank you. You must see the expertise of our panelists, expertise, the experience, the way they speak, the way they give the wisdom. My job is very simple. I'll just summarize one or two points. One is, I take from Shika's point, is that processed food, processed is anything that is altered, industrially altered. And processed food is worst food of all. So whether it's a packed food, or whether it's a packed vegetable or packed sauce, everything is packed soups, Even the noodles that you eat every day, 2 minutes or whatever noodles you eat, they're all processed. So stick to the natural sources of nutrition. Do not add. Certainly stop your artificial sweetener. I would even say stevia. Stop, because you don't know what is mixed there. And daily exercise, plenty of water will make you live longer. Overall calorie have to be down. The moment you decrease your calorie, you will equalize your diet to any other diet, whether it's a keto diet, or the intermittent fasting, or zone diet, or denourished diet, or whichever diet. All will not equal the diet you are taking. And that will be the healthiest diet of all. I thank all my panelists. Please give them a big hand. And I thank Rajput sir, I thank Kesri sir, everybody who's been associated with this wonderful program to give us all opportunity to present our views.
Thank you.
Thank you, Dr. Anoop and the entire team of panelists. Let's have a huge round of applause, ladies and gentlemen. And with that, I would now invite Mr. Anil Rajput sir to please present the memento to our panel. Can we have the mementos, please? To Padma Shri Dr. Anoop Mishra ji. To Dr. Shikha Sharma. To Dr. Rekha Sharma. To Dr. Ishi Khosla. And to Dr. Rajesh Kesri. May I please request all the panelists to please come forward for a group photograph. Ladies and gentlemen, let's have a huge round of applause. All right. Last but not the least, ladies and gentlemen, we move on to the next session, which is subjected around dealing with waterborne diseases like cholera, diarrhea, dysentery, and hepatitis. So, ladies and gentlemen, I would like to invite our chairperson, Padma Shri Dr. Soumitra Rawat, Chairman.
Ma'am, we are live. Please go ahead.